So let's look at ODD, Oppositional Defiant Disorder. So these are criteria that were written by adults for adults to administer, right, to give children diagnoses. So the diagnosis starts with a pattern of angry, irritable mood and argumentative, defiant behavior. So there's no exclusion criteria. There's nothing that prompts you to think about or consider, does the child have things to be angry about? And have the adults and systems in their lives been consistent and helpful? Because maybe they're argumentative because what their stepdad has asked them to do is completely inappropriate and actually abusive. Angry, irritable mood. We all know as mental health providers that this is a very non-specific symptom, right? It could be something that is associated with impaired affect regulation, neurotoxic exposures, intellectual disability, PTSD, depression, substance use disorder, whether it's intoxication or withdrawal. And then argumentative defiant behavior, and that's described as often argues with authority figures or for children and adolescents with adults. So it doesn't have to be a reasonable adult, it doesn't have to be a kind adult, it doesn't have to be a consistent adult, it doesn't have to be an adult that has their best interest at heart, just argues with any adult. And so that begs the question, right? Have the adults in their lives exercised good judgment and reliably acted in the youth's best interests? Another criteria, actively defies or refuses to comply with requests from authority figures or with rules. So that assumes that the rules have been clearly communicated, that they've been stated in a way that the child can receive, that have been tailored in a way that is developmentally appropriate and also accounting for any intellectual disabilities the child has, and that the rules are the same from venue to venue, right? Which often is not the case, especially in youth with families that are challenged. And so the child is being pathologized and you're checking off a symptom for something that really could represent an environment where directives have not been clear and consistent and there's confusion. And so what we see here, just with this brief example, is that the child who is the member of the marginalized or disadvantaged group is given a diagnostic label that we all know is very stigmatizing, while the behavior of the advantaged group, the adult, is presumed to be right. The criteria are written and interpreted by adults who decide what is included and what is not. And what we often see is that the child's reaction to a family system or to structurally driven problems is pathologized. And just as the child's behavior takes place in the context of a family, the family system functioning takes place in the context of the larger society.